Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Complication of malnutrition. Number 3, that is infections. In malnutrition, most common type of infection seen is gram negative infections. The child does not have any focal infections. If the child does not have, see, the child can have either focal infection or it can be systemic infection. If the child does not have any focal infection, then you should give oral cotrimoxazole should be given. If you see any evidence of infection like fever, increased leukocyte count, anything, any evidence of infection, then you can give IV ampicillin with gentamicin is given. But if you suspect staphylococcal infection, then cloaxacillin can be given. If there is no response or if there is evidence of meningitis, then IV ceftriaxone or IV cefotoxim or IV ceftriaxone can be given if there is no response or if there is evidence of meningitis. Complication.
thank you and thank you for watching.